All right, so California Democrats, led by none other than gruesome Gavin Newsom, have officially let their single-payer healthcare bill for the state of California die in basically the single most corrupt and pathetic way imaginable. So I want to get into exactly how this happened and where the corruption lies and who's to blame, but just to give you guys an initial understanding of how the makeup of the California legislature is right now, Democrats have a supermajority in both the state Senate and the state Assembly. Okay, you can see here the state Senate is 31 Democrats and 9 Republicans, and then the Assembly is 60 Democrats, 19 Republicans, and 1 independent. So there are no Republicans standing in their way when it comes to legislation like this. This purely falls on the shoulders of corrupt Democrats who are not willing to do something that they have basically been wishy-washy promising to do, especially Gavin Newsom himself ran on this policy, something that they have been promising to do for years and years and years in this state, and have just completely failed to do so in the most pathetic ways imaginable. So just to start us off here, a good breakdown from Common Dreams' Brett Wilkins saying progressives vow to fight like hell as the California single-payer bill is withdrawn. So he says California progressives on Monday expressed shock and outrage as a bill that, if passed, would have delivered single-payer healthcare coverage to the nation's most populous state was withdrawn from a highly anticipated floor vote in the state assembly. And he says minutes before AB 1400, which is what the bill is called, the California Guaranteed Healthcare for All Act was scheduled for a floor vote in the California State Assembly. The co-author, Ash Kaura, a Democrat, pulled the measure from consideration, and Monday was the last day for the bill on the legislative calendar. In other words, it's dead for at least another year due to this Democrat, Ash Kaura, basically under the behest and the guide of a lot of these insurance companies that flood money into the California Democratic Party, basically just let it die. Okay, so this was the last day. It happened on Monday. We're now on Wednesday, so it's not happening. Okay, they just completely gave it up. They didn't even bring it to a vote. Okay, they let it die before it even got to go through the entire legislative process, let alone end up on Gavin Newsom's desk. So they had a statement here from National Nurses United saying that today elected leaders in California had the opportunity to put patients first and set an example for the whole country by passing AB 1400 in the state assembly. Instead, Assembly member Ash Kaura, the main author of the bill, chose not to hold a vote on this bill at all, providing cover for those who would have been forced to go on the record about where they stand on guaranteed health care for people in California. So again, this is not a concept that we are new to, right? This is why a lot of people were arguing in favor of something like a Medicare for all floor vote in the House, right? That's why there was that entire movement that happened on the left, and there were problems and debates that went around that. But the general idea is let's try to hold these people to account, right? Because there are plenty of politicians, both in our federal Congress that we have and also in the state of California, who will come out here and say that they support universal health care, or they will come out here and even say, I support Medicare for all, or I support a single payer healthcare system. And then when it comes down to voting for it, we don't even get to know where they actually stand, right? Kamala Harris is a co-sponsor of Medicare for all. Now, does Kamala Harris support Medicare for all? No, she absolutely does not, right? Nancy Pelosi, all the way back in the 90s, supported a single payer healthcare system. Does she support it now? No, she doesn't. And not only do they not support it, but they don't even have to take tough votes on it, right? So that's part of this entire process was let's get these motherfuckers on the record and sort through the weeds and find out exactly who actually means what they are running on, instead of just virtue signaling and that they don't actually want to back it up when it comes to a tough vote like this. So that's the situation that basically unfolded. Now we get to how did this end up happening, right? And unsurprisingly, it's basically just the same brazen corruption that is baked into the entirety of the U.S. political system. So here from David Sirota and Walker Bragman on the Daily Poster, they do great reporting, so go support their work. But they give a good breakdown here, basically giving some of the history and how this unfolded and who exactly was funneling money into the state Democratic Party. So they say Newsom's big choice, single payer or his insurance company or his insurance donors. And so obviously this was a little bit outdated. This was before the deadline passed. And we now know the answer to this question is he chose his insurance donors. Okay, very unsurprising. But they say on the 2018 campaign trail to become California's Democratic governor, Gavin Newsom signaled his support for a statewide single-payer healthcare system. He said, quote, I'm tired of politicians saying that they support single payer, but that it's too soon, too expensive, or someone else's problem, Newsom said in a statement helping to secure him the crucial support of the state's powerful nurses union during a contentious gubernatorial primary. So, I mean, he's literally saying, not only do I support it, but I'm tired of politicians who continuously say that they support things like this, and then when it comes down to it, they push it off and make up a bunch of bullshit excuses as to why this is not the right time or why we can't do this right now. So he was calling out the people who he now is himself, okay? And we got another quote here to put it even more in perspective in terms of how much he has actually flipped on that entire idea that he was running on just a couple years ago in 2018. So they get perspective here saying that the current legislation, AB 1400, would establish a new agency called CalCare that would pay for basic medical services in the state. And if it passed, Californians would have then voted on whether to approve a tax increase to fund the program, a vote that might not have happened until 2024. Now, here's just the 180-degree turn from what we just heard from Gavin Newsom up above, where he was calling out other politicians, okay? Now he has to say, I have not had the opportunity to review that plan, and no one has presented it to me. What do you mean no one has presented it to you? It's been around. You could have gone and looked at this plan. You would have had to been completely intentionally avoiding the existence of this plan to not understand what is in it, okay? You are the governor of the state. This is like one of the main policy proposals that you yourself were running on, okay? So how would you not have been aware of it? That just seems completely absurd at face value. But he continues saying, I think that the ideal system is a single-payer system. I've been consistent with that for well over a decade. The difference here is when you are in a position of responsibility, you've got to apply, you've got to manifest the ideal. What the fuck did he even just say? You've got to apply, you've got to manifest the ideal. What does that even mean? This is hard work. It's one thing to say, it's another thing to do. Yeah, I mean, it certainly is, and we're seeing the difference on full display right now with an absolute corrupt coward like yourself, Gavin Newsom, who is saying one thing on the campaign trail and then not following up and actually doing it once you're elected into Congress. I mean, or elected to the governor's position. I can't even I want to read this sentence just one more time so you can try to get a glimpse of what he actually might be trying to say here. The difference here is when you are in a position of responsibility, you've got to apply, you've got to manifest the ideal. This is hard work. I mean, what the fuck are you talking about? When you're in a position, you were running for the position that you are in right now. So why would you run on one thing and say, and even call out other politicians who run on something and then don't end up doing it? And then you yourself run on something and then turn around and make up vague excuses that we've got to manifest the ideal. I mean, it's like he's not even trying here, really. I mean, but that's not the real reason. I mean, at the end of the day, we understand that whatever manifesting the ideal, whatever the fuck that means, that's not the actual reason why he can't get anything done right now. The reason why he didn't want to aggressively push for this bill to end up on his desk so that he could sign it into law is because of shit like this, okay? So they point out $1 million check from Blue Shield. So they say Blue Shield of California has been a huge donor to Newsom and state Democrats, as well as the governor's pet causes. Blue Shield has donated at least $99,000 to Newsom's campaigns since 2010 and $2.7 million to the California Democratic Party since 2006, according to data from the National Institute on Money in Politics, and that includes a $1 million contribution to the state party last summer as Newsom was working to fend off a recall effort. So over $1 million donated from just Blue Shield of California, okay, to his party and to his own, campaign coffers, okay? So in other words, he's being bribed. But they continue here with more examples. The insurer Anthem and its affiliates have donated $78,000 to Newsom's campaigns since 2013, on top of $770,000 to the California Democratic Party since 2002, and Anthem also gave $25,000 to Newsom's 2019 inaugural fund, and as well, United Health Group, the nation's largest health insurer, which I just covered on a different video on this channel if you want to go and watch it from a couple of days ago, where we found out that basically almost the entirety of United Health's revenue that they are bringing in from their insurance handouts that they are giving to people, they're basically just stealing money from the federal government. A significant portion, a vast majority of their revenue is coming directly from U.S. taxpayers through the federal government programs like Medicare and Medicaid. Okay, so again, United Healthcare, all of these other insurance groups, they're basically just mafia rings. Okay, they're completely bullshit corporations that shouldn't exist in any functioning society at all. Their entire business model is to profit from denying people healthcare. But United Health Group, the nation's largest health insurer, is also opposing the single-payer bill and has been pressing its employees to lobby California lawmakers against passing the legislation. And they say the insurance giant has contributed $130,000 to Newsom's campaign since 2011, and $513,000 to the state Democratic Party since 2007. And in 2019, United Health Group and one of its other subsidiaries donated $100,000 to Newsom's inaugural funds. So, to sum it up at the end of the day, it's the same shit that is baked into the entirety of our political system, both at the federal level and clearly at the state level, okay? You have a guy who literally ran his campaign saying, I principally believe in single-payer healthcare systems, right? He even continues to say that right now, even as he's not doing anything to actually get it implemented and passed, okay? He runs on this. He specifically calls out politicians who say things on the campaign trail and then make up bullshit excuses, once they're elected into office, and then he turns around and does that exact same goddamn shit. I mean, it's so pathetic, it's so egregious, and it's just a slap in the face to all the countless thousands of organizers who have put in like their literal blood, sweat, and tears and their own money to try to fight for this, okay? I mean, we still live in a country where medical costs are the single largest cause of bankruptcy in this country, okay? Over 500,000 Americans go bankrupt every single year because they can't afford their health care, okay? We have between 40 to 60,000 Americans who die every single year due to a lack of quality health care, okay? We are currently paying more in both a total sense and a per capita sense and by a portion of our GDP on healthcare than any other country in the entirety of the developed world, okay? And we are getting lesser results. So we're bankrupting people, we're being price gouged by mafia-like insurance companies, and we're not even getting better healthcare out of it. So at the end of the day, the single-payer healthcare system is the path forward here in the United States, okay? Obviously, I would want to push for something maybe even more aggressive than a single-payer system. I would like for the entirety of our healthcare system, the entirety of our big pharmaceutical industries to be basically completely nationalized and socialized. I don't believe that we need the profit motive to exist in any way, shape, or form in any semblance of a healthcare system or pharmaceutical system. So, at the end of the day, the single-payer healthcare system at the national level is what we need to be pushing for. Clearly, you need more than just external pressure. Clearly, you need more than just this, state-by-state approach where these massive insurance companies are going to be able to simply bribe a lot of these politicians, both in the Republican Party and obviously the Democratic Party as well. If you're just going to be able to use this divide and conquer approach, then it seems like it's going to be damn near impossible to pull off because, Democrats have, as I said at the beginning of this video, a super majority control over the California legislature, okay? There's nothing standing in their way other than themselves and their own corruption, and yet we still can't get it done. This is something that is overwhelmingly supported by the majority of people living in California, okay? So it's completely ridiculous. It's obviously and brazenly corrupt, and they just let this opportunity pass to actually do something that could improve the lives of millions and millions of people and actually use it as an opportunity, as a jumping off point to set the standard for the rest of the country. I mean, California is one of, if not our single largest state, okay? So they have tens of millions of people, roughly like 45 million people living in California, and you could use that as an opportunity to prove that a single-payer healthcare system can be more efficient and can deliver better health outcomes for, a population. So it's just a completely missed opportunity from Gavin Newsom here and from California Democrats. It's completely pathetic, and you really feel for a lot of the organizers who put in all of this work to try to get it to this point, just to be completely shit on and slapped in the face by some corrupt motherfuckers within the Democratic Party.